All right, welcome to the Inclusive Health Care Taskforce Summit. My name is Philip Barnhart, and I am here today representing, among several other folks in the room, the Michigan Public Health Institute. And as you all know, we are partnered with Detroit Area Agency on Aging and AARP to create the Inclusive Health Care Taskforce. So a couple of technical minutes here. If you can, we're going to cover a lot of information today, and there will be lots of chances for us to ask questions. But we are hoping that for this first part of the presentation, as Elizabeth Whitaker Walker takes us through the report, we hold off on our questions, write them down though, and then when we come time to ask questions, we have two options. We can raise our hand. For those of you who do not know how to do that, reach out to me and we can figure it out, or just put it in the chat as well. We can do that. So I think that's the only technical question I have. Please try to remain muted through this because the extra noise kind of, upsets the apple cart. And without further ado, I would like to introduce a new colleague who I enjoy working with. Her name is Elizabeth Whitaker Walker. And she's a strategist and coach who has led social justice and diplomacy projects across the globe. She is the founder and principal of Raymond Whitaker Design, LLC, a consulting firm committed to equity-centered leadership and organizational development. During the last 15 years, Elizabeth's work has spanned education, public policy, community organizing, and more. She has helped to build schools, design anti-racist policy platforms, and create political leadership pipelines for marginalized communities. In 2017, she was named a PAHARA Next Gen Fellow, joining a dynamic cohort of 24 education thought leaders from across the United States. Elizabeth has trained political candidates, educators, nonprofit leaders, foundation executives, youth and community organizers across the nation. Her expertise in education, public policy, cultural literacy, leadership development, and facilitation provide a platform for thoughtful and courageous dialogue. Elizabeth is a graduate of Northwestern University, devoted mom, wife, and bookworm who loves to read, travel, and cook soulful vegan food. She has been featured in a wide variety of publications, including Thrive Global, Fast Company, Ladders, Goalcast, Intuit QuickBooks, Her Money, Board Source, and more. With it, my great pleasure, I introduce to you Elizabeth Whitaker Walker.
Thank you so much, Philip. Good morning, everyone. Happy Thursday. It is great to see all the smiling faces and smiling pictures in all these squares across the screen. I hope everyone is doing well and that you're got a good start to the day. So today, as Philip and others have shared, today is a day for the big reveal. And I just want to once again, thank all the partners who have collaborated to get us to this very special day. Now, before we dive into this beautiful document, we want to warm up a little bit with a couple of quick poll questions. And so, Philip, if you're ready, we can go ahead and put those on the screen. All right. So the first poll question is, the task force organized itself according to the 5, A, Great Lakes, B, social determinants of health, C, Jackson's, or D, most densely populated communities in Michigan. So we got 13 answers in, 15 answers. Getting those answers in, we're warming up our fingers, warming up our brains. All right. All right. So far, no one has said the Jacksons. So we'll share the results in just a moment. All right, so we have 37 of 50 responses so far, 38. Who will be next? And I promise your name doesn't come up on the screen. So whether you got the answer right or wrong, we won't know. We'll just know what the group consensus was. So let's see, we got 41 of 50, almost there. We're at 82% who've participated, 86%. All right, we're inching up close to 100. All right, get those responses in. We'll just give this a few more seconds. And then we will share out. All right. So we've heard from almost everyone for this first poll question, and we can go ahead and end the poll. All right. Uh-oh. Can you all see the results? Did it pop up on your side? That's it. Okay, there we go. So 82% of you said the social determinants of health. 9% said the Great Lakes, and 9% said the most densely populated communities in Michigan. And the correct answer is the social determinants of health. And we'll share a little bit more about those in a moment. But the task force that came together to thought partner, to brainstorm, to strategize, organize itself into 5 different committees, and each was centered around the 5 social determinants of health. All right, let's go to our next poll question. And I can, here we go, and poll. All right. Did it pop up on your screen? The second poll question?
And then it went away. It popped up and went away.
Oh, let's try.
Because we're both trying to launch it. I will let you do your work, okay?
Okay. Let's try that again. So second poll question. All right. Can you see it? Okay, we're going to keep it moving, but let's share. And you can type your answers into the chat box.
I can launch it right now.
Oh, you can? Okay, great. All right. So the second poll question, one through line. So one theme, core concept that the task force saw all across domains, like across all subcommittee areas, just like just sort of an overarching theme or through line that we saw throughout the course of this collaboration was A, the impact of the digital divide, B, lack of awareness, or C, declining Netflix ratings.
We're looking at the results, not the questions.
The results haven't come in just yet.
Right.
Are you able to type it in?
No.
Okay.
It said 0. Yeah.
So let's put it in the chat box. Let's use a chat box. So if you think it was A, the impact of the digital divide, we'll want to have you type that in. Oh, okay. So there we go. It's up now. B, lack of awareness, or C, declining Netflix ratings. And we have some folks chimed in the chat. We've got some responses for A. All right, we'll give folks a few moments to think about that. So one through line that we saw throughout the course of this collaboration was A, the impact of the digital divide, B, lack of awareness, or C, declining Netflix ratings. Okay, we're at about 81%, 83%, And again, whether you got the answer right or wrong, we won't know. We'll just know what the group said. So let's see, what do you think? One through line. And we'll take maybe just a couple more seconds. And Philip, I think we can go ahead and end the poll now. All right. So 61% of you thought that it was the impact of the digital divide, 39% said lack of awareness, and no one thought it was declining Netflix ratings. So the correct answer was the impact of the digital divide that you'll hear about a little bit later. So one through line that seemed to touch on every single area that we discussed during the course of the collaboration was around the impact of the digital divide. And so when we get to that part in the action plan, you'll have a little bit of context around it. We actually spent a lot of time thinking through kind of what strategies specifically needed to inform choices around really solving for this. Okay, so I'm going to stop sharing that. And I'm going to take us to the big reveal. So let me share this. Okay. And so just a moment, I'm going to pop it up onto my screen. Again, as Philip shared earlier, later on in the afternoon or in the morning, we'll have a chance to really dive in and have some discussion. But right now, I'm just going to take you through the actual document, show you how it's set up. And I want you to take some notes. So if you have some paper nearby, or if you like to type on your laptop, whatever is convenient for you, jot down notes, questions, things that stand out to you, so that when we get to that portion of the day, we'll have a chance for that discussion. Okay. So this is the final document. And so I'm going to walk you through the document, walk you through how it's set up, what you can find in this document, and share a little bit of context about how the group got here. When we get to the portion when we do the deep dive and kind of hear some of your responses and also get into the panel discussion, you'll get a chance to ask some of the questions around why. Right now, we're on the what part. So the what is, this is what the group came up with. And so on the second page, you'll find a short overview of how we got here. If you recall, during the first poll question, we asked you all, how did the committees organize themselves, or how did the task force organize itself? And it was into 5 committees, each representing one of the social determinants of health. So health, community and social context, education, neighborhoods and built environment, and economics and retirement. So you're going to see those 5 different domains pop up throughout the course of the action plan. And so the work started about 6 months ago. All of the committees met to come together to think through priorities, core objectives, and key results to show that those objectives had been met. And as well as thought through some of the partners that needed to be at the table in order to achieve those objectives and key results. Now, a little context on the digital divide. As we mentioned before, the digital divide was a through line throughout everything. And so at Stanford, during a study, they found that as a population ages, many older adults find themselves socially isolated, and sometimes that can be life-threatening. Additionally, older adults have lagged behind the rest of the population in terms of their access, their ability to access the technology needed to operate on the internet. And so when those 2 big factors come together, the situation can be dire in many cases. When we think about the pandemic and the impact of these 2 issues on top of the pandemic, it becomes even worse. And so that's one of the reasons we called this out. And so in order to address this, the task force outlined 3 goals specifically related to the digital divide that must be grappled with before any other actions can be taken. Now, in this report, not only will you see how which action steps were connected to each social determinant of health, but later on, towards the end of the action plan, you'll actually see specific areas where the task force tied strategies to the digital divide specifically. All right. Now, objectives and key results. One of the first things that the task force did was to think through what are some of the overarching objectives or North Stars when it came to each social determinant of health area. So for health, it was to improve the health status of older adults through enhanced access to care and technology and to reduce premature death and health disparities in older adults. For education, equal accessibility, earmarked funding outlay for aging and their programs, with seniors having a voice in what's best for them. Economics and retirement. Everyone has adequate access to income and benefit throughout life to yield their financial security. Community and social context. Better coordination of resources among supportive service providers. Neighborhood and built environment. Engage all generations, including private and public sectors of the community in creating a place to age safely and successfully. And direct strategies to combat the digital divide, to draw out from each determinant of health a plan to which to overcome barriers through the use of technology while also overcoming the digital divide. And so when we get to the coming pages, you'll actually see what are the specific key results that are tied to these overarching objectives within each area. So within health, community and social context, et cetera. For health, I'm going to put the key results on the screen. Actually, let me make that a little smaller. All right. And so each social determinant of health component or section of this report is organized like this. You'll see the key result, the key results, which are the major aims. And in each area, there's between 1 and 4 key results. And what are the action steps that are connected to those specific key results? So for instance, the first key result within the health domain, dramatically increase the amount of time healthcare professionals need to spend in geriatrics during their residency, education, or practicum. The core action steps that are connected, you can see on the screen. And then partners, who will be involved and what role will they play? Okay. The next key result, all aging adults will understand their insurance options and policies so that knowledge will activate access to care. You'll see the core action steps that are connected to this key result. And we see who those key partners are. The third key result, all aging adults have access to affordable, comprehensive insurance. You'll see the core action steps, identifying census and other data to track the current level of access, a citywide campaign and toolkit, and exposing younger people downstream earlier to healthy lifestyles so that aging becomes a natural process for older adults, parents, grandparents, friends, and community members, and activating intergenerational supports through children, youth, young, and older adults. And you'll see the partners listed here. And finally, the fourth key result within the health domain is home health aides and community health workers are trained to provide a wider array of services for their patients, participants, including education around digital technology with increased pay. The action steps involve building curriculum, providing training opportunities, and providing training to DAAA Service Provider Network and other organizations. And you'll see some of the partners who will be involved in that work. Now we'll move to the next social determinant of health domain. Education. Okay. And again, the overarching objective here is equal accessibility, earmarked funding outlay for aging and their programs, with seniors having a voice/input into what's best for them. The first key result is a passage of a senior millage or earmarking of lottery or senior education tax funding for programs serving the aging population. Some of the core action steps, starting with a community poll, then drafting that millage proposal, moving through a marketing campaign, and moving through the approval process to get the millage passed. You'll see who will be involved, the specialized task force. The second key result is the establishment of a public access channel for older adults, created, produced, and directed by those aging in place. And some of the core action steps connected, you'll see, and who'll be involved in that. Now, of course, what you see here, you see the core action steps. Behind any of the action steps you see here, there literally could probably be like 35, right? 35 steps. When you kind of get to that level, we didn't want this plan to be, a 200-page document. So you see the core action steps here, but one of the things that I imagine that will come after this process, and really when you're starting to figure out which partners will be involved in what stage of the actions and whatnot, you'll have a chance to, to think through what are the steps to get to those core steps. Economics and retirement. The overarching objective, again, is everyone has adequate access to income and benefits throughout the life course to yield their financial security. And so the first key result is all aging Detroiters are financially literate and lead discussions about economics and retirement planning across the lifespan. The core action steps: first, establishing a stakeholder group of representatives of older Detroiters, have quarterly marked meetings between stakeholder groups and policymakers to discover problems and solutions that lead to positive economic health outcomes for older Detroiters. And you'll see the partners who are named below. The second key result: everyone has adequate access to income or benefits throughout the life course, including job and placement assistance for encore careers. We see the action steps connected are to increase availability of employment and training opportunities and teaching financial literacy in non-traditional settings. And these are some of the partners who've been named here. Community and social context. Again, the overarching objective being better coordination of resources among supportive service providers. So the first key result is people who are aging alone have the same support as those who are aging within a family structure. So 75% of surveyed Detroit solo agers indicate that they have a plan for aging, understand supports needed, and how to access available resources. Those action steps connected to that start with a survey of a sample of Detroit solo aging population on their aging plans, conducting a follow-up survey to determine significant increase in knowledge and understanding, and finally ensuring that every toolkit, program, campaign, and other approach takes solo agers into account. You'll see some of the partners listed there. The next key result: partner directly with United Way of Southeastern Michigan in their Close the Loop program. Use social determinants of health navigators to help partner agencies better coordinate and integrate care inclusive of our anti-ageism campaign. And so this, again, is about the development of that toolkit in partnership with the United Way. You'll see the partners listed there. The next key result, establish and market social engagement programs through the MOU described previously with United Way. Review DAAA resources for existing social engagement programs, look for those gaps and develop or search to fill those gaps based on the research that's being done in that program. You'll see the core action steps listed there, as well as the partners. Neighborhoods and built environment. So again, the overarching objective is to engage all generations, including private and public sectors of the community, in creating a place to age safely and successfully. The first key result, city and state policies allow rather than impede aging Detroiters to stay in safe, secure, and affordable housing. You'll see some of the core action steps that are listed, which involves engaging a large or a critical mass of the community in the total work of the task force, identifying champions, reviewing and researching current city and state policies and programs, and finally identifying current needs and developing a plan for the future, so new policies. And you see some of the partners who'll be involved listed there. The second key result under neighborhoods and built environments, aging Detroiters who are experiencing substance abuse disorders, mental health concerns, or dementia have the support they needed or need. The core action steps first begin with identifying gaps in programs and supports, identifying opportunities for collaboration, and identifying partners in the mental health field to provide the necessary training, education, treatment, and support. You'll see the partners who'll be involved. And finally, the last two key results in neighborhood and built environments, age-friendly communities with intentional, affordable, and accessible housing, home repair services, transportation, walkable communities, parks, and other amenities, clean air and water. The action steps will begin with a task force who will begin to look at kind of a landscape analysis to look at other cities' plans to look at their success rates and establishing partnerships. You'll see on the screen the partners who will be involved. The fourth key result, public safety, engagement of block clubs, community development corporation to safeguard seniors. The core action steps involve accessing a directory of block clubs, preparing special outreach, and partnering in all the work or partner the work with contacts. And you see some of the partners who will be involved. Okay. If you recall, the through line, folks remember the through line? Big hint is on the screen right now, overcoming the digital divide. So the next section of this action plan really speaks to how strategies to look at overcoming the digital divide through a lens of health, through the lens of economics and retirement, et cetera. And so that's what you'll see on the pages that follow. And so again, the overarching objective is to draw out from each social determinant of health a plan to overcome those barriers. Those direct strategies begin with, gathering statistical data and mapping regarding who has devices, who needs devices, and broadband access. Establishing a think tank or a training center. And the thinking behind that, the group said, what if there was actually a physical space that could hold trainings and facilitate roundtables and really function as a think tank and also a workspace for that task force? And you see the partners named below. And now we'll get into these strategies through the lens of each social determinant of health. So health and the digital divide. All aging adults are comfortable and knowledgeable using technology for telehealth and other healthcare needs. The action steps involve gathering baseline data on older adults with access to technology, providing training to older adults and caregivers, and working with community and public partners to provide access to technology and Wi-Fi to support telehealth and other access to care. And you see the partners who are listed there. And really, again, that key result, at the end of the day, having a measurement on the increase in older adults, like using those devices and technology, that will be kind of the core indicator to let the task force know that this key result has been reached. Education and the digital divide. Each grandparent raising or helping to raise grandchildren receives the necessary tools to provide educational support. And the indicator will be that funds will be earmarked from that senior millage or those lotteries that we discussed previously, and strategies. Core action steps involve identifying grandparents who are raising or helping to raise grandchildren, developing a training curriculum to mirror state standards, and training advocates to complete field work in center schools and in-home settings. Economics and retirement and the digital divide. So you've heard a toolkit come up a lot, and it's one of the kind of key outcomes that the task force spent a lot of time thinking through. So a publication of a toolkit designed to address financial concerns for seniors, including estate planning, end of life decisions, especially retirement, but can be used by all ages and really built upon over the course of life. And so the vision is to have that toolkit published and distributed to every person who's 50 and over, to have copies available in libraries, community agencies, etc. You'll see the action steps that are listed. And you'll also notice that there'll be quite a few partners involved in this, because again, if the goal is to have it distributed to every person who's over 50, want to reach everyone from the city to community agencies, universities, and even radio stations to help get the word out. Community and social context and the digital divide. The key result here is development of a senior-directed social media app. And the engagement rate will be measured by clicks per use and those issues published. Core action steps you'll see on the screen, as well as the partners will be involved in the development of that app. Neighborhoods and built environment in the digital divide. The key result here is city planning and infrastructure decisions accommodate or assure technology for all across the lifespan. Broadband internet included as part of the City of Detroit's utility bill, right? And so it would start action steps to get here, starting with the community span of existing technology and current partnerships. To access citywide programs that are already in existence, so not reinventing the wheel, and then a campaign to distribute devices along with training. And you'll see the partners listed here. Now on the final page of the action plan, took all of the insights that all of the committees developed and put together a logic model, basically where you can see strategies at a glance. So if one doesn't have time to look through the 23 previous pages of the action plan, this is what strategic action looks like at a glance. So the first column, you'll see the inputs. These are the things that will be front-loaded in order to see the strategies and the outcomes come about. The strategies, you see some of the core strategies just kind of synthesized: convening stakeholders, centralizing resources, reducing tech disparities, building curricula, expanding policy, human-centered programs and app design, and finally building financial security. And you see the outputs here, disaggregated by social determinant of health area, what you plan to see, and then what that means in the short term and the long term, you see in the black box on the end. We know, of course, the context. Here we are in year 2 of the pandemic, and hopefully, we won't be here much longer, but we don't know, right? This is a current context. We know the digital divide is part of that context, institutional racism, inequitable funding formulas, economic hardship, staffing shortages, policies and politics always come into play. And also at the bottom, you see kind of overarching tech priorities centered around device access and broadband internet access and knowing how to use those devices. Right. And that is the page at a glance. So I'm going to stop sharing this. And again, we're going to get into formal discussion a little bit later in the morning, but have a couple of questions that we would love for you to think through. Okay. Now, one thing that we're going to ask you to do a little bit later is share what we call a fist of 5. Now, what a fist of 5 does is it invites folks to really see kind of how much of a consensus we really have around the action plan. And so you'll see this again later, that in a poll that'll come up a little bit later. But a fist or a 0 is like, no way, I'm not with this plan, I will block it. A 1 is I see major issues that we need to resolve like right now. 2 is I see minor issues that we need to resolve now. 3, I see minor issues that can be resolved later. 4, I am fine with it as is. And 5, I love this and I will champion it. So again, a little bit later, we're going to ask you, and again, we know that you haven't like gotten a chance to sit with this for 48 hours and process it, but we just kind of want to do a temperature check to see where folks are. So when we get to that portion, this is a video, not a video, this is a visual that'll help you connect to those numbers when you see that opportunity to share out in a moment. All right. The first thing we'd like for you to think about, if you haven't written this down already, what part or component of this plan stands out to you the most? And so I invite you right now just to jot down a couple of notes on a piece of paper, or even if you want to type it in the chat. What part or component of this plan stands out to you the most? I'll give you a moment just to think about that. What part or component of this plan stands out to you the most? And I invite anyone to put that in the chat if you'd like, just so we can see what stood out to you the most. Not all at once, though. The overall approach of navigating the digital divide through the social determinants of health, right? Other thoughts, engaging all generations, especially when we think about the intergenerational transfer of knowledge and culture, for sure. Economic and retirement planning, other things that stood out to you. Collaborations and partnerships. Yes, all those partners you saw listed. Yes. Training and caregiving, the digital divide, the opportunity to be intentional about building health literacy, giving older adults a voice in the efforts. the technology divide, intergenerational, right? Considers the whole person and all that contributes to the quality of life. Yes, Michael. Having senior millage or earmarking of lottery or tax funding for programs that serve the aging population. Increasing the amount of time healthcare professionals need to spend in geriatrics. We have a lot of catching up to do. Yes, Lisa, and should have been paying attention to this divide for decades before the pandemic forced us to acknowledge it. Yes, or amen. The toolkit to address financial concerns, right? The last part, yes. Importance and emphasis on digital divide. Tech is getting smaller and faster. All right. Well, the next question I want to ask you is, what are you most excited to work on to support this plan? Now, I know we haven't asked you to sign up for anything just yet, and I'll let the panel and our partners at our various organizations take you through that part. But want to know, like, what are you most excited to support? However you may decide to support, what are you most excited to support? All right, broadband and utility bill, the think tank and toolkit, yes. Any other thoughts, things that you're really excited about to support, even if support means you're telling somebody about it, right? All forms of support count and are valuable. Other things that you're excited to support, right? Healthy aging, opportunities for intergenerational collaboration, the role of community health workers in teaching older adults about tech. Love it. Right. Healthcare access and education, neighborhood and built environments. All right. So now that we're warmed up and acquainted with this action plan a little bit, I'm going to turn it back over to Philip to get us into some deeper discussion about what all the implications of all of this and what we need to think through to actually get to that vision that we described. And with that, I'll turn it back over to Philip.
Thanks so much, Elizabeth. That was wonderful. We're going to, what I want you to do right now is take a 30-second break, stand up, stretch if you're able, or just sit in your chair and stretch out your arms, take a nice little deep breath. And we are going to segue into a rich panel discussion. So while you continue to stretch, I'm going to do a little screen sharing here. I am. Okay, and I'm gonna move my face off there. Can you all see that? Elizabeth, can you see that fine? Is it sharing? Okay. So we've made a little alteration on the agenda. You don't know that because we didn't give you the agenda slide, but just so you know, we're going to have a facilitated panel discussion, and then we'll take a small break, and then we'll come back for a very robust community conversation. Okay, so I would like to, it is my very great pleasure to introduce the executive team of this project, beginning with Ronald S. Taylor, who is the president and CEO of the Detroit Area Agency on Aging, Dr. Renee Kennedy, PhD, who's the president and CEO of the Michigan Public Health Institute, and Brenda Price, who is the Associate State Director, Community Outreach in Metro Detroit of AARP Michigan. So I'm not sure how to highlight these folks on the screen, but if you could all come on off mute, and if you want to introduce yourselves more robustly, I appreciate that. And we're just going to talk about these three questions. And if I can help facilitate or kick us off, let me know. But maybe we just begin with this first question. How can the public and private sector positively impact health disparities and the technology gap? And maybe just sort of riffing off what we see in our report.
Mm-hmm. Well, I'll jump in on this. I mean, I really, in this role, have considered myself sort of a participant observer, right? So I was in some things, but not completely. And but just watching the amazing process that we went through as a community. And so when I think about sort of that public and private sector partnership, one of the things I was thinking about was the tension between political will and whether or not, we could really motivate sort of elected officials to see the importance of this work and get them behind policies. But that notwithstanding, I think what we're driven by is a clear amount of social will. Like, we as a society, as a collective, have come together to say that this is our problem, not just, the problem of people who are aging, because in some ways we're really all aging, but there's not the problem of people above some number of years, but it is really our problem. And we do have the social will to prioritize this, I guess is what I would say. So I think that's how we begin to see change happen between private sector and public sector. It is all of us seeing ourselves as a part of society and elevating the importance of this problem together.
Thank you so much, Dr. Kennedy. Ms. Price or Mr. Taylor, what are your thoughts on that?
Ms. Price?
Yes.
Okay.
I think that part of the challenge with the public and private sector being engaged, it doesn't impact them, particularly in the private sector. It's not on their agenda. So they need to be better informed about what the challenges really are in community. The public sector, particularly when it comes to elected officials and beyond elected officials, are the administrators who actually carry out any public policy or develop the rules and regulations. They also need to be more informed about the impact of some of the challenges and the healthcare disparities and what it means for community. I think the biggest gap is connecting the dots on what the realities are and what the impacts are, and what some of the solutions and ideals are of the practitioners who are actually working at it every day that can help the public and the private sector resolve some of the major problems and then some of the nuances that go along with it. I think that's the biggest challenge, and carving out that time to do that. We get busy in our work, no matter who you are, in the public, private, or nonprofit sector, and we don't get the opportunity to communicate as we've done right here. This has been enlightening for me, and I'm sure probably for others, but informing and engaging the public and the private sector, those decision makers in those sectors, is very important.
Yeah, and I would just piggyback on what Dr. Kennedy and also what Ms. Price said. I think both approaches are most appropriate, because there is we do have to continue to educate and to raise the awareness as far as the interconnectedness of the social issues and how they impact and they influence on businesses and also the communities. And I'm not certain that there's been that direct correlation as related to the impact of such. And so we have to continue to raise that and raise that flag and to continue those dialogue and that conversations. And as Dr. Kennedy spoke about, there is a opportunity at this particular point in time in which I believe COVID has really provided us, it's been unfortunate that we've had to go through this pandemic, but it's really ripped that Band-Aid off that's related to exposing some of the inequalities, and as far as in our healthcare systems, but also as far as some of the racial systemic issues that our country has faced, and how it's impacted as far as environmental concerns, educational issues, and then also just employment opportunities. So it's across the spectrum. So there's a willingness and there's a dialogue to engage, or to at least have a conversation that we have to continue to push. Now, what I would say is that we have to, it's been great for us to have that dialogue and to have those conversations, but those discussions, they have to permeate or result in action. And that's one of the things in which we're going to have to continue to work on as far as the figuring out. But I also believe that the policy considerations are going to be critical. And, you know, I recall, you know, I believe it was Thurgood Marshall who came out and said, especially in the heights of the civil rights movement, that everything is good and everything is fine as far as our social actions and the social demonstrations and everything are taking place. But unless we get some things implemented in a policy format, then it's going to be difficult for it to be sustained. So we're really going to need to work to have some of these policy conversations focus on the social alignment with medical care. And that needs to be baked into some of the things that are coming in from what CMS is promulgating to the accountability factor for some of our health system partners, along with some of our community-based organizations. So there needs to be, our public policy is going to have to push and have to drive that social and medical alignment for us to really sustain and to push this needle further. And we as advocates and as what I'll say as voices of the community, we're going to have to be the drum majors to get this accomplished.
You know, Philip, if I could, I would love to just sort of rubber stamp or amen one of the points that Ms. Price made also, because this idea that, you know, private sector, people just don't think about some of these things. And I just think that's so important. Mr. Taylor was talking about how we've got to get out there and get the message and make it known. And those of us that are steeped in this all the time, we just sort of assume, of course, everybody knows this, but they don't. And we have some odd sayings in our culture sometimes. And so there's that quote that ignorance is bliss. It's really not. Ignorance is killing us and killing our seniors. And we've got a lot of work to do in this space.
So now I'm wondering, what approaches can be implemented in Metro Detroit to better coordinate and integrate the social determinants of health?
Well, okay, if I go
ahead, Dr. Kennedy.
I'm just going to make one little comment because, you know, I'm going to defer to the true Detroiter, Mr. Taylor. But, you know, I think, again, in sort of this participant observer role, Detroit has sometimes had this reputation of not wanting to play in the sandbox and having sometimes a competitive culture. And I think what we experienced in this process busts that myth, blows it right out of the water. I mean, the authentic and deeply committed conversations that we've had, partnerships that we've had, just people showing up. I mean, you know, we've got plus 60 folk on this call today saying, no, this is important, has been critically important. And so that commitment to stay in relationship with each other, I think is going to be especially important.
Yeah, I would second that. And, you know, I would also say that this initiative has been beautiful just to see what I would say as far as the voices of the community and some of the main actors that have come together, and to you know, some of the real what I'll say as far as community stakeholders that have been involved in aging and what's occurred. And it's very it's enlightening as related to the results and some of the recommendations that have come forward and that have been shared and that have been discussed. And, you know, and I've sat back and I've also kind of witnessed, watched it from a distance, and, you know, keeping our team members, keeping us abreast and updated as related to what's happening. But one of the things in which I've always shared with our team throughout this process, that in order for us to really to take this initiative, you know, it's that old African proverb: if you want to go fast, you go alone, but if you want to go far, you go together. And in order for us to really go far, we're going to need to have what I'll say is a sincere engagement from other segments of our community and other industries that's going to need to be a part of us truly addressing these social determinants of health. So as we begin to work to implement and to better coordinate and to try to address some of these social determinants of health, it's going to really require a collective community conversation. We're going to need the folks from the environmental community to be at the table. We're going to need to have the school systems at the table. We're going to need to have government at the table, the food industries. So I think for us to really take this far, that for us to truly integrate that, we're going to have to all collectively come together as far as representatives of our various segments of our community to push this needle. And so, but I think this conversation and this dialogue and the personnel that are involved in this, we're off to a great start, and we just need to continue to push it.
And I would agree with Mr. Taylor on that. I would also like to add in that in order beyond integration is some accountability in our community. There are a lot of stakeholders involved. There are a lot of players. There are a lot of decision makers. But the bottom line is we push the P, and we need to move away from pushing the P down the road or off to another agency and determine who is really accountable for moving the needle on these matters.
And so this final question, and then I think what I'd like to do is maybe take the remaining time that we have with our executive team to answer some questions directed at them through the chat, if you'd like. But I'm wondering, and given the fact that this is a discussion based on all the information that everyone's bringing to the table, what do you think can be done to eliminate the widening gap in health and social disparities across the lifespan?
I think there is a need for a broader education model that brings people into the understanding of what happens down the road much younger in life. There needs to be an integration in the K through 12 area with older population or topics so that they also learn what happens down the road, so that they may be able to identify with careers and opportunities that will help society as a whole, that will make them think about, maybe I can serve this population in this capacity. But I do think it is about educating people and changing people's lives so that they understand all aspects of what can happen, the good and the bad. If you, we do a program where we go into colleges, AARP does, and we talk about disrupting aging and ageism. And when we leave, generally some of those students have an understanding of what ageism is, and they might even think about, well, maybe I want to be a social worker and I want to work with the geriatric population. You know, maybe I want to be a geriatric nurse. You know, maybe there is something that I want to do in planning, that I make sure that I design communities for people of all ages. So I think part of it is just informing and engaging our community about this population and about these issues early in life, not when it happens to them.
Absolutely. I love the strength position, Brenda, of that point that you make. You know, when I think about that question, Phil, the very title of this task force, inclusive, right? That word inclusive takes us back to what Ms. Price is talking about accountability. Are we going to be our brother's keeper? Are we going to hold each other accountable? I remember that the organization Black Mamas Matter had the motto that said, "We are no longer asking permission to save our own lives. And I think we can say the same thing as a community. We are no longer asking permission to assure that our lives as we age stay healthy, stay robust. You know, the wisdom and the knowledge that we have as we grow, how are we going to sort of change that dominant narrative of like old age as opposed to healthy aging, right? And the vibrancy and importance. And Ms. Price suggested an example there where seniors and intergenerational younger adults are really having those conversations. And so one of the things that I know for sure as a public health professional, that the idea of vigilance is critically important. So for example, in some of our communicable disease trends, let's just say sexually transmitted diseases, we had a point where we just didn't see syphilis at all. Like we weren't getting syphilis reports, but then we kind of let our guard down. And sure enough, syphilis came back on the scene. We saw the same thing. If we're not vigilant with COVID and coronavirus, if we're not watching what we're doing, applying the things that we've learned, we're going to see spikes coming right back. And so holding ourselves accountable and being vigilant that no, this is the way we want to go. We're going to shift the narrative that changes the culture, that changes people's attitudes. And we begin to work together to understand that, you know, if I'm that for an educator, it's important for the people that they're educating to be healthy physically. If I'm in transportation, it's much easier to transport people that are knowledgeable and educated or that are fit and healthy. And so seeing how inclusive and connected we are as a society, and I think Detroit can just be sort of that textbook example of a large urban setting that crosses boundaries and divides to partner. That's an example that's replicable across this state and honestly across this nation.
Yeah, I would just have to say amen to Ms. Price and also Dr. Kennedy in regards to their comments. And, you know, kind of getting a little bit off track, but not too far. But one of the things I thought of that is beautiful about this initiative and about what's occurring has been the intersect between public health and community-based organizations and social services organizations. And I think that's going to have to continue to be a norm versus an aberration as related to us going forward. But I'm also reminded of the Dying Before Their Time report, and when it talks about the lifespan issue. And one of the things that was really revealed in that report is that it's important for us to address health literacy at a younger age, because really what we're doing, and I think this is symptomatic or emblematic as far as what can be applied in some of these other SDOHs, but what we're doing is we're treating issues or we're treating chronic conditions once the individual is in 55, 60, or in later adulthood, where what if we shifted the paradigm and addressed or provided education and also some other interventions early in the lifespan, we can be treating or we could be preventing instead of treating. So I think it's important for us, as Ms. Price said, to really work with our school systems and in the K through 12. And I also think like some of our initiatives like intergenerational programs would be critical in regards to when you're talking about societal norms and values, and you're talking about financial literacy and health literacy and the like. If you can have those elders of the village or those elders that are at the front gate, stopping and passing that knowledge down to the younger generation and to help really strengthen that community. So again, I just had to echo what Dr. Kennedy and what Ms. Price said, and you know, we're all just going to need to work together. But some of the other some of our other partners in the community are going to be key in regards to us addressing these disparities across the lifespan.
So this has been wonderful, and we're going to continue this now in a little bit of a different frame. Thank you, all three of you, for so fully answering these questions. So I want to just remind our participants that we have three folks who are national thought leaders in public health and in aging. And so let's take the opportunity to continue this conversation until 10:30, and then we'll take a break. And so I'd like to move the conversation along by lifting up something Jamie Jr. put into the chat. They say, I think this presents an opportunity to create more synergy between our senior, golden, and disabilities communities, because many of the needs are very similar. Would someone like to take up a response about the relationship potential between the disabilities community and our aging seniors, or our aging population?
Wholeheartedly agree. I wholeheartedly agree, and I think we're all in the same sandbox, and we do need to work closer together, and to reflect that the Administration for Community Living, which is kind of our federal governing entity, they do administer aging services, and then also programs or administer disability services. And so we recognize that we utilize many of the same, or we provide many of the same services. We utilize many, or our dialect and our conversations and our delivery systems are very similar. And so there really shouldn't be, and our goals are the same in regards to the servicing that for our constituents. So there should be more synergies and more opportunities to collaborate and to work together to service and to serve our community at large. I agree wholeheartedly.
You know, as I just listen, and I'm definitely a learner in that space, but it would seem to me that that's another wonderful opportunity for intergenerational work. If you take a young person with a disability partnering with an aging person, that there's some different level of lived experience, compassion that comes there. So, I mean, this is how creativity and innovation happen, right? When communities come together and brainstorm and think. So I really appreciate that question.
And I too think that there's an interconnection there because that disability community is very broad. It is inclusive of all ages and includes veterans who are a large part of our community. So there is a need for it to be interconnected to any body of work.
And I'll just add in there something that I was trained up to think about and do think about every day. Disability or ability is one of the only intersectional barriers or intersections that can change for us over time and will change. So whereas I may be fully abled at age 30, if I live long enough, God hope, then I will experience disability, you know, whether it's hearing loss, sight loss, whether it is mobility issues, or I may have some other thing happen and experience different types of disabilities. So I think that that's an interesting thing to think about, that we're not that far away from our own changing ability, moving into disability. We have some other wonderful comments here. I just want to lift up Crystal. She says, the doctors told Steve Harvey what you do in your 40s, will diagnose you for in your 50s, treat you for in your 60s, and bury you for it in your 70s. Educating earlier, prevention is still the key, right? Fayana Richards, Dr. Richards loves this intergenerational connection. She's a colleague of mine, and I know she's done deep, deep work in the, especially I think she told me that the grandparents raising grandchildren and educating is an issue clear to her heart. Claudia Sanford says, in regards to housing, many disabled near seniors are let out of low-income housing opportunities and other services, left out of low-income housing, right? So I wonder, maybe we could have a talk about housing a little bit. This has come up as such a grave issue in Detroit, and I'm sure all over in our work.
Yes, I've been involved with Claudia. I'm glad she brought that up in the organization of preserving senior housing in Detroit for low-income seniors that is getting away from us because the market is different now. There's an opportunity for landowners to sell their properties at a much higher rate, and they've been doing that. So that's displacing people. But it's all about public policy here. The public policy says that we do affordable housing, and affordable housing does not serve the low-income population because it is still too expensive. So I think that's also a part of the education in community, is that we understand the terms. So when policymakers and elected officials are telling us that we have lots of affordable housing coming into our community, but that's still not inclusive of everybody. So part of it is understanding the language so that you can challenge, or if you're sitting at a table, you can ask about what's the difference between affordable housing and low-income housing. And we need low-income housing in our community because the population is not going away. We still have a growing low-income population, unfortunately, in our community. And there's a greater need than there is housing. So Claudia works directly with that work. I commend her highly for what she does and some of the buildings that she goes in and the people that she's trying to help. The other part of the public policy piece on that is, where are the regulations for that help people who are in low-income housing or even in affordable housing that have terrible landlords? All of these things exist in our community. So it goes back to that, who's accountable, who's asking the questions, who's being responsible. But I'm really glad that she brought that up because there still is a need. And the other inclusive piece of that is, who's building these types of housing? There was a time when our nonprofits were involved in getting the resources to be able to build low income and affordable housing. But that money is not necessarily there for them because they often need money that does not come directly from the federal government for pre-development. Otherwise, our faith-based institutions that have been doing this work over past years would still be doing it. So the question should be asked, who's getting the resources in our community so that this population can be housed, especially as they get to be older adults and they no longer have the potential to be able to generate income.
Homelessness and preventing homelessness is a shared problem. That is where I think a prime example of social responsibility steps in. We talk a lot in healthcare about personal responsibility, where you got to get out and exercise. This is an example where social and collective responsibility is really critical. And we take for granted, or maybe we don't even consider the impact of policy. I'm going to give you another health example. Like, if you look at potatoes, are pretty cheap. Like, why are potatoes so cheap and broccoli is so much more expensive? Well, there are these things called potato subsidies to potato farmers. That's a policy. That was some stakeholders, some community members, some advocates coming into play saying, hey, knock, 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 Mr. Elected Official. And so we have to recognize our power because policy change is happening all around us, and we need to be the ones influencing that.
That's correct. That is so true. And just to add on to what has been well stated on this issue, is I think that we also need to do some things in regards to, for those seniors and those individuals that currently are in homes or in their own private residences that may need some assistance as related to the upkeep and the maintenance of those facilities or those homes. And if they don't get that support then it could potentially put them in a real health and safety concern status, and or may require them to leave the community to go somewhere else. So I think that there needs to be ample, and I saw Ms. Menendez or Dr. Menendez make the comment that funding is needed everywhere, and that is so true. But there really is funding is needed to help us maintain or to provide home repair services for our current constituents in this community.
I just want to lift up all of the amazing information that Ms. Price brought into all of this process around the housing issue. And I also want to just sort of say to all of us that there's so much opportunity for us all to get involved, right? Because when Ms. Price talks about the liaisons that need to take place, the liaising that needs to take place with all of these structures and systems, that requires people, right? To go and talk to these developers, to go and get together a task force to get a senior millage passed, to talk to the policymakers. So, you know, we have lots of stuff in the chat about the housing issue, and I invite you all to read them, read the chat. I want to just sort of lift up. Claudia Sanford says housing policies such as first right to refusal for tenants living in affordable and low income housing. This is in place in many cities across the country. And Laura Riddick says low income is definitely different from affordable housing. And that's something I learned in this process. What is the narrative directed to, or better, who is this for as it relates to affordable housing compared to low income? And I know Ms. Price has lots of things to say about that.
Can you repeat that question, Philip?
I sure can. Pardon my dogs, they're excited. Low income is definitely different from affordable housing. What is the narrative directed to, or better, who is this for as it relates to affordable housing compared to low income?
Well, I think who it's for is for the decision makers in our communities and in our state to look at what type of housing they are trying to attract and recruit. Developers come to the table with the mindset that says, I want to do market rate housing, that they're in business. They're trying to make a profit. So the public side of the table needs to come up with a solution that makes it reasonable for the developer to consider doing low income. Guarantees of their money. Those are all federal dollars. Their federal dollars and their state programs and their local municipality decisions. So it needs to be a mindset at that level that says, we are going to incorporate low income housing in our communities. So it's just simply being accountable to your public. But if your public doesn't know that there's a difference between low income and affordable, then there is the challenge. But then there's also another gap in there. We call it gap housing at AARP, where there is that retired school teacher or administrator who can afford to move into something when they want to downsize, but that property may not be available in their community either. So the whole housing issue for the older population, the question needs to be answered across the board. Are we filling in every hole that is needed for older citizens in our community to continue to reside in our community? And that all turns into an economic question that I think we've kind of touched on it here. But the fact that this population, even if they're on fixed income or low income, they bring resources to our community that we don't talk about. They bring healthcare dollars. That's why we have these major healthcare systems in our community, because they're customers. And so they bring resources to the community that the local government does not have to generate. So, you know, there's a lot of interconnection here and a lot of benefits. So I think one of the things that we might think about is also raising up all of the positives about this population that people tend to ignore.
One of the major goals of this is to increase public awareness, right? I firmly feel that if we understand better, if it's front of mind better what's going on, then we will be called to act. I really believe that we can be rattled out of our torpor and apathy as a society to act for the greater good. But we need to be aware. We need to be urged to do it. We need to be invited to do it. We need to be, maybe in some cases, badgered to do it. Mary Carmen Munoz would like to loop back to wellness education. A big issue in our community is the availability of classes in Spanish. We are having a difficult time finding certification classes for our wellness educators to teach wellness classes in Spanish. Jennifer Mendez, Dr. Mendez offered a source for Ms. Munoz, but maybe we can talk about overall wellness education as it applies to all Detroiters.
You know, Philip, I think one of the big points I get out of that question is really a principle of equity. Like, seniors are not one size fit all, and we just come up with this program and here, all y'all go have at it. But recognizing that the equity principle would drive us to assess what are unique needs amongst different sectors and aspects of our aging population, and how do we adapt that? I mean, sometimes with prevention, education, programmatic work, we get really stuck on this thing called fidelity to model. Well, the research says you have to do it this way. And quite candidly, sometimes that is just not the best way. How do we give ourselves permission to adapt things based upon the needs, and honestly, based upon what seniors are telling us? Here's what I need, and this would be helpful if we could do it that way. So I appreciate that question to make us think about what are the unique needs of all of this important community.
I want to invite you all to look at the chat. I also want to lift up my colleague, Claudia Sanford, who, when I said Ms. Price brings so much to the table about housing, Ms. Sanford has brought so much information to my mind about housing, right? Like, and she actually writes in here something that is astounding to me. And I also want to appreciate Crystal's comment about returning citizens, whether they're in the senior category or younger returning citizens. We really, from a Flint-based standpoint, near and dear to my heart, how do we protect and uplift those people who are returning to us, right? But I want to close out this section by lifting up Ann Davis's question. How can we engage the technology industry to address the digital divide? We have about 4 minutes, folks.
Well, the technology industry does get involved in this work. In my past work, I have been involved with the private sector technology industry in partnerships with local municipalities. So when they are asked to come to the table, they do. They have to be asked. I partnered with Wayne State. They've brought their tech vendors. They come to the table because the academics, the corporations, and the municipalities ask them, because they are their major customers. So they do come to the table. So I think it is just a question of asking and what the ask is to get them involved. If you remember, some years ago, whole cities were trying to go to integrate broadband. There were a lot of challenges with that, but there was an effort to be made at that. But I think we've seen a lot of change in their level of participation. The whole broadband access and bringing the costs down through the emergency broadband program has been successful, but that was also led by the federal government and the FCC trying to make sure that the digital divide closed a little, particularly in rural, but also in urban areas. But it is just a question of having a plan and making the ask.
That it reminds me, your words, Ms. Price, remind me of the quote, the verse that says, "You have not, for you ask not." We need to ask, and I think we really need to reverse this narrative that seniors can't learn technology or don't want to learn technology, that the technology audience is the younger gamers and students. That's simply wrong. And how do we change that narrative, begin pushing that no, not only can seniors use technology, but they want to use technology, if only as a mechanism to engage with younger populations, right? So a lot of reframing to do.
Yeah, I completely agree. And, and I think that the role of technology is going to be critical as we move forward. And as far as just the access to healthcare, as far as telehealth and things of that nature, but, what's evolving, started to have some conversations within our team as related to like, what is the impact of virtual reality, these meta products in regards to health and promotion or health and education and or just lifelong learning or just healthcare. And so, I think we need to take that misnomer off, as Dr. Kennedy said, as far as the limitations of older adults and more seasoned individuals as related to learning and embracing technology. And I think, we can't pigeonhole them either, because you have various stratifications of what I would say would be the lifespan. And so just all individuals that are 55 or older or whatnot don't have the same interests, don't have the same likes. So I think we just need to continue to embrace the technology and to roll it out and to share it with our population. And I think the technology community will be supportive of such, because they're also driving a lot of these interactions and promoting a lot of these programs and services for us.
Can we just take a second and give our executive team some enthusiastic love for the amazing leadership they provided thus far in the project, and I'm assured to continue on in the project.
And Philip, if I could just take a quick second, and
Yes.
I just really like to thank AARP of Michigan and Ms. Cunningham, Paula Cunningham, and Ms. Brenda Price, along with MPHI and Dr. Kennedy and Philip and the rest of the team, just for the collaboration and for the dialogue and just for the behind the scenes work that has taken place, but also just for embracing and for collectively saying this is something we need to do, and we're on board, and just working together to push this conversation. So from DAAA, I'd just like to say thank you, AARP and MPHI.
Thank you.
Okay.
It's been a joy. I've learned so much from this group.
Yeah, thank you for calling.
Okay.
Thank you. I'd like to make a comment.
Go right ahead. I can't see who's making a comment.
Okay, I'm Rose Cutler and I'm on the advisory committee, and I would like to make a comment about seniors and the technology. In the city of Detroit, our libraries could be an avenue where seniors could receive free tech support. However, many of our libraries are not open. And so if something could be set up so that there would be a senior day or times when seniors could get to their local libraries to receive technical support, I think that would be very helpful.
Ms. Cutler, that is an excellent idea. I don't know if you put that in the space earlier, but what I'd like to do, if it's okay with you, is I'd like us to take a short break, and then please come back and let's discuss this more fully as the community starts to engage with how can we each of us get involved to implement this action plan.
Okay.
Oh, thank you. So what I'm going to do, because I'm random. Oh, no, I'm not random. We're going to come back in 13 minutes. Yes, that is random. At 10:45. So take a nice break. Again, Mr. Taylor, Dr. Kennedy, Ms. Price, a million thank yous. Dr. Taylor or Mr. Taylor, I hope you know that I'm in love with DAAA. If I ever leave MPHI, which I'm not going to, I will become knocking on your door. Okay.
Well, it will be open, Philip. And also, before we go forward, I would be very remiss if I didn't just say thank you to Ann Holmes Davis. And
Unbelievable person. I love her so much.
Yeah, and Kashar, just thank you so much for spearheading this and bringing this together. Much appreciated.
Okay, friends, 10:45. We'll see you back.
Thank you.
Anything we need to do during the break?
I don't think so, Ann. Take a good break. I hope that seemed really good to me.
Yeah,
So
the first half went very well.
it's going to be wonderful in the second half. I'm going to step away.
Me too.
I'm not getting in there. No, who didn't? I believe.
Welcome back, everyone. If you can, if possible, come off your screen so we can see you. Don't feel like you have to, but we're going to go into the next section of our meeting now, which is really open discussion, dialogue, maybe some brainstorming, and then we're going to close out just before noon with a call to action and to give you a formal invitation to continue the work with us. So I'm going to just do a little bit of housekeeping with my friends here. Elizabeth, are we?
Good morning.
We kind of pivoted. So are we just good to go into the this discussion? And Anne?
Yeah.
Okay.
And I'm happy to also kind of pull back up some of those slides, those warm-up refresher slides, just so that we can connect all the dots, if that would be helpful.
I think so. I think that this will be sort of a in the moment type of experience right now, and we'll just go with it. But I know that there are questions, and so I'm going to try to bring up the chat, and maybe we can start off with just what you all experienced. What are your feelings? I don't want to lose sight of Ms. Cutlett's question about the libraries and accessibility, but maybe we could just start a little discussion around what did you experience? Are you excited? Is it time for the Fist of Five? Elizabeth, what are we doing?
Well, let's start off with a couple of quick things. Maybe we can go back here. One of the questions I asked folks to think about are, what are the components of the plan that stand out the most to you? Also, what are you most excited to work on? We had some conversation in the chat about these components, and people kind of shared out some of the things that bubbled up the most. In our panel conversation, we got able to dig into those, some of those topics in a really holistic way. And so what I'd love for folks to do right now is kind of based on what you heard of the plan, based on some of the key action areas, based on some of those overarching objectives. And let me put those up on the screen too. We're going to do a check-in on that Fist of Five, and just give me one moment.
We had great response to the Fist of Five activity that Elizabeth introduced to me anyway. So this is an exciting moment too.
Okay. So just to highlight some of those overarching objectives that we talked about, in the plan. For health, to improve the health status of older adults through enhanced access to care and tech, and to reduce premature death and health disparities among older adults, equal accessibility, earmarked funding outlay for aging and their programs, with seniors having a voice in what's best for them. Everyone has adequate access to income and benefits throughout the life course to yield their financial security. Better coordination of resources among supportive service providers, engage all generations, including private and public sectors of the community, in creating a space to safely age, or to age safely and successfully. And finally, to draw out from the social determinant of health areas a plan to overcome barriers through the use of technology while also overcoming that digital divide. And so as we think about these overarching objectives and the key results that we spoke about earlier in the day, we want to hear from you about kind of where you sit with the overall plan. And so let's do a quick temperature check. So if you're at a 0, that's no way, I block this. 1, I see major issues we need to resolve now. 2, I see minor issues we need to resolve now. 3, I see minor issues we can resolve later. 4, I'm fine with this as is. And 5, I love this, I will champion it. And so would love for you to type in the chat either a 1 through 5, just to see where folks in the room are. And I'll give folks a moment just to type in their numbers. All right, I see 5. Yes, all right. I see some 5s coming in. A 3 and a 5, right? 5. All right, more 5s. Okay. Right. Anyone else who hasn't gotten a chance to type in their fist of 5 just yet? All right, more 5s. Okay, a 3. Okay. All right, a 3. 4s. Right, and it looks like we do have consensus. We have the overwhelming majority. We're at 5. We have a couple 3s and some 4s sprinkled in. So we are in a good place. And so now I'll actually turn it over to Anne, Krishara, and Philip to really kind of get into some of the reactions from the plan. We know where people sit, that there's generally consensus. And so we want to hear, like, why are you excited to support this? Like, why are you ready to champion, or what about this is really standing out for you that makes you want to, like, get ready to go? If there are some minor issues that we can work on later, we want to note those as well so that we can think through those in our next steps. But I'll turn it over to Philip, Ann, and Krishara now to really walk through some of those responses.
Thank you, Elizabeth. I'm thrilled to be here today and to hear all the discussion around inclusive healthcare. Just was curious about, for those people who registered a 3 or a 4, are there things that you think are missing that the plan needs to embrace that will take you to a 5? What are some of those things that were presented today that would move you to be more excited, so we can be inclusive in our discussion? And you could place that in the chat if there's some areas that you think we could shore up as we move forward. I'm really thrilled that we've been able to engage all of you over the course of the last 6 months. It's been great hearing the dialogue around social determinants of health and the digital divide. I've, for many, many years, been engaged in Dying for Their Time research, and I see those trends continuing and exacerbated by the pandemic. But I'm really, really pleased that people are compassionate about standing in their own truth and looking at ways that they can partner with others to make the eradication of health disparities possible. So what are those things that you think we could add to the table?
And in answer to your question, Dr. Jennifer Mendez replied she would have liked to see some of the other stakeholders on this session today.
That's something that we will be working on feverishly during the implementation phase of the Community Action Plan. We will be approaching public partners in particular, as well as some of the partners that we invited but were not able to engage. I think that since we have a community action plan that can be distributed and shared with them, we can begin that dialogue. And it definitely will take the engagement of the technology industry, municipalities, and community stakeholders, as well as consumers, to stay engaged.
Michael Deichling said, I like the diverse group of partners. I saw the Federal Centers for Medicare and Medicaid Services and many local organizations. However, I did not see the State Department of Health and Human Services, which operates the Medicaid program.
we can definitely add that to the plan. And MDHHS has gone through a name change recently. We will be interfacing with the Health and Aging Administration Services Department. So that has been a change that we made in the document.
Winona Bynum commented she would like to be able to review the plan. She didn't notice much emphasis on food, but may have missed those pieces during the review.
Sure. We will be distributing the plan later today or tomorrow morning so that all the members can get a copy of it. So, and that's something that we can include as well. We did talk about economic security under retirement and planning, but food is something that we could add. And I know that the Coordinated Food Consortium has been looking at this important issue. Any other ideas around what may be missing from the plan that would strengthen it? Because when we walk away from this summit today, we want to have consensus on what's included in the community action plan, because we want the community to own it and feel thrilled about implementation.
Jamie Jr. commented she would like to see more intentionally around engaging the disability community. This will become vital in the coming months as we move towards the enactment HBCS.
That's an exciting comment, and we definitely can include more discussions around the disability community, because it definitely takes a village, and there is that emergence of disability community and aging, as well as our intergenerational community.
And Jamie, I see you're off mute. Could you tell me what HBCS means and what the relevance is?
Yes, sir. I actually transposed it. So it's HCBS, which is home and community-based services, which encourages people to have more anonymity when it comes to their living situation, and also with the more and more people turning to Medicaid waivers where they can receive their services at home versus in senior centers or hospitals or other institutions. So more and more people who are disabled and seniors will be moving back into the community. And so these programs will have more and more significance and importance.
And that's definitely important. And one of the things that DAAA implements is the My Choice waiver program. We serve individuals 18 years old and over who have a disability. So we are very much in support of that. Thank you for your comment.
Thank you for that, Jamie Jr. Also, if there are folks that have dialed in, you may raise your hand in the chat by pressing *9 on your phone. We'll recognize your hand and you can leave your comment or raise your question there. Thank you for those that have entered into the chat. If you'd like to speak, you can also raise your hand in the meeting digitally. So Jerry Hardy, I'm sorry, said great presentation. Thank you for that comment. As a consumer, it seems great as is. After living with it for a while, I could go to 5.
Great comment. And we're very, very pleased that we have Elizabeth Whitaker Walker with us today. She brings that excitement to the equation and was kind enough to get all of the wording from our last meeting into this document. So we're thrilled about that. Now we'll move on to the next question. What other partners do you think that we need to bring to the table to implement this plan? I've heard a couple of communities, the disability community, as well as making sure that we have some of the state departments engaged. But are there some specific organizations, grassroots wise or otherwise, that could add value to the Inclusive Health Care Community Action Plan.
I think you should bring on the Wayne County Veterans Group.
Great comment, Brenda. Any other suggestions?
Phil replied in the chat, he would love to see some arts organizations.
No, I really love the discussion around really expanding and enhancing amenities throughout the Detroit area around gardening and arts and parks and those kinds of things. And I think that that could definitely enhance the lives of older adults and individuals with disabilities.
I'll also add my own comment. I'll say nonprofit developers.
That is definitely key. And with the discussion of the panel earlier, Ms. Price definitely noted the need to have the nonprofit sector at the table, particularly as we look at affordable housing. And there's been a lot of displacement of older adults in the last 5 or 6 years as housing became market rate. We've gotten redevelopment in Detroit, but we've also lost older adults access to affordable housing. So the engagement of that industry would be wonderful.
And this is Donna. I think that we need to get some of our state representatives or legislative individuals involved in this as well, since they're the ones who have the power to make the change.
I definitely agree. And we definitely need to look at not only the state legislature, but also our Congress representatives as well at the federal level.
Helen Love said,
As well as local elected officials.
my apologies. Helen Love said, consider the launch of monthly Zoom sessions to engage more members and more sectors of the general public and spread the word.
Great idea. I think we definitely need to keep the momentum going. One of the plans that we have is to take the community action plan and to seek additional resources from the Michigan Health Endowment Fund, who is supporting this particular planning grant. And one of the things that we'll be looking at over the next couple of months is what kind of bridge funding we can put in place so that we don't lose momentum and we can jumpstart some of these efforts. So we definitely need to look at that engagement of the public and community stakeholders so that we can keep the momentum going, and also start looking at banks and corporations and foundations who could also support our efforts.
That was Jamie's comment. She said banks and CRA.
Thank you so much, Jamie.
And Ana Rosa De La Rosa said she's been thinking about individuals who are undocumented. At their senior center, LaSalle, they service many individuals who are not documented and therefore cannot access programs such as My Choice Waiver. She's learning about what is available for such individuals. So there's information. Maybe there's information she's not aware of, but something an issue that definitely needs to be spotlighted.
And I think that's definitely true. And that's something that we can look at, because earlier we heard about returning individuals, and I think the hidden segments of our community are also important. And we definitely need to make sure that there are interventions in place that can assist them. And we always want to be moving in the direction of diversity, equity, and inclusion.
Claudia Sanford commented that the Presbyterian Villages, Michigan, is already engaging on these issues in their housing. There are developers, Develop Detroit, Volunteers of America, CSI are all members of the Senior Housing Preservation of Detroit Coalition.
Yes, and Detroit Area Agency on Aging is also a member, and that is a fantastic organization that has done some great work in protecting the rights of older adults who are being displaced from senior high rises and other areas, Midtown Detroit and beyond. So we can definitely add some of the additional partners to the table within our community action plan.
You might
Any other
want to add,
comments?
you might want to add LISC. I know you have United Way there, but LISC does a lot, particularly with housing, and they're involved with the 0% home loans, and they're, you know,
Definitely,
community
definitely.
development.
We will definitely add this, and also Michigan State Housing Development Authority does a lot around affordable housing, as well as, of course, HUD.
And
Thank you so much for that comment.
The other thing is that when it comes to economy, maybe you might want to include Detroit Employment Solutions, since they're the major source of training funding, and sometimes older adults have a harder time getting that funding because they're not looking always for full-time work. So they might need to hear some of the discussion too.
I agree. Thank you so much for your comment. Detroit Employment Solutions. We also have Michigan Works.
They're pretty much this. They are the Michigan Works for Detroit.
Right. Well, at the state level, and then the local provider. Any other comments?
Yes, the AARP Foundation Senior Employment Services Program here in Detroit.
Yes.
Yes.
Yes, CSEP is critically important to older adults 55 years and over. And I'm pleased that AARP Michigan has that program in Detroit as well. And then
actually they are a separate entity. That's why I wanted to note them. Okay.
Yes.
Excuse me, this is Jamie Jr. speaking again. And I remember earlier in the conversation, there was talk about home repair programs, but I'm also wondering if you can engage stakeholders around modifications, because as people age, they may need modifications to their home to be able to stay, like a ramp, a larger bathroom, a stair lift, or something like that. And there are not a lot of programs for that.
You are absolutely right. And those environmental modifications really allow people to age in place and live more comfortably within their homes and prevent falls and other injuries. So those are very, very much needed. Thank you. Any other comments? Okay, we'll move on to funding and resourcing the Inclusive Healthcare Plan. I'm sure that it'll take a good $1 billion for us to implement all of the recommendations that have been included in the Inclusive Healthcare Community Action Plan. What are some of the resources that you think we could bring to the table to assist us in implementation in the short run and also in the long run? Now, we talked about the Michigan Health Endowment Fund, implementation funding. Are there other dollars, other funding resources, and also in-kind resources and expertise that we can bring to the table? Philip gets excited about this idea of a think tank. You know, where is there a space that can be available so that we can come together and do further planning? We talked about an app that can be available to all older adults and individuals throughout our community, so they're aware of the community resources that are available. We also talked about a toolkit. What are some of the resources that we may not have shared earlier that could support these efforts? And I heard about the AARP Foundation just earlier with Brenda Price.
And I wanted to bring something up along those lines. So clearly I don't have the authority that some folks earlier have on the call, but those folks have authority because they are really super busy doing all sorts of stuff. As am I, but if I call the CEO of Little Caesars to ask for an appointment, I'm probably not going to get one. However, I can climb that ladder in Little Caesars. I can make those connections to those sources of funding as a major corporate entity in Detroit. Same with the Millage Corporation, same with Quicken Loans, right? It doesn't, just because I am me, doesn't mean I can't do the work to maybe get us in a position where somebody with more authority then is able to make that call and make that big ask. So I just want to urge us all that we really all have agency in this, as even with the fundraising aspect, even with the big fundraising aspect.
Go on.
I was going to say, I would encourage a serious strategy around the approach to fund development, and actually maybe even finding money to pay for such a person, because there's a pattern in this community that programs for older populations are not supported by the philanthropic community. I mean, you can count them on one hand, those who actually support such initiatives. But the reason I think there needs to be a strategy and a narrative developed is because there is a story to be told about the interconnectedness of all of this work and the impact that it has on the community as a whole. And the one thing all of the funders are concerned about is the viability of the community. And so I think there has to be a connection of the dots on why this population is important, how the body of work intersects with maybe the body of work that they do, what's in their mission. But I think it takes a little effort to go into going after funders who traditionally don't fund in this space.
That's a great suggestion, Brenda, because it will definitely take a concerted effort over an extended period of time, relationship building, partnership building, the right messaging in order to communicate what's needed and to make the ask. So you're absolutely right. On the private side, there's going to be a need for that. And there can also be some work on the public side as well. And then the other big issue that's included in the community action plan on the public side is this whole idea of a senior millage. And at this point, I think there are about 63 counties within our state who are, in front of us and have a senior millage. But that was one of the recommendations that's coming out of this group. And it's sort of centered more on education, but this can be definitely broadened to include funding for a variety of different programs under this initiative. So on the public side, possibly having a fund developer dedicated to driving this issue to the philanthropic community. And then on the public side, looking at senior millage and how do you take the message to the public, get their support, and then put a strategy in place to implement a county millage or a city millage.
And also,
hopefully not community by community,
yes,
but it may take that as well.
Yes, and also identifying some champions from the private side.
That's a wonderful idea.
In this,
You always need champions to carry the message. Any other suggestions?
Michael Daishling suggested that we target the American Rescue Plan Act for funding.
Wonderful suggestion. Those dollars are just going into the coffers of a number of organizations, and this is the time to earmark some resources for this effort.
And we have a hand raised by Helen Love. We recognize your hand. You may unmute and speak.
I just had an idea that there are lots of retired professionals from both the public and private sector who would make for a really nice targeted group for brainstorming. the community relations folks, the government affairs folks, a team of those retirees around here would be off the chart in terms of brainstorming, seeing where we are, because a lot of them would have had some undone projects and can bring a lot of energy and just good brain power to the table.
You rock, Helen. Always have some great ideas. And I think that brain trust that you mentioned would be absolutely fabulous to engage people in who may have more leisure time on their hand,
Right.
have the expertise and those connections that can help get the job done.
Yep.
Fabulous
A
idea.
breakfast at DAC and you're off and rolling.
Wonderful idea. Any other ideas around how do we fund the community action plan? Those are some great suggestions. And of course, you can continue to provide us with information. One thing that I wanted to point out before we get into our next question is the fact that DAAA work with its communication and marketing team consisting of Deanna Solomon, Chloe Holmes, as well as Helen Love. And we have created a inclusive healthcare webpage on our website. So if you go to DetroitSeniorSolutions.org, you'll see inclusive healthcare, and you'll be able to get updated information about our plan. The plan will be posted there. We have a lit review, we have best practices that were provided to us through Wayne State University medical students. We plan to have updates on where we are, what we're doing. We're going to, of course, list our partners who are at the table now. And as we add new partners, we'll add them as well as sponsors. So please visit that page. And that's where you're going to find the community action plan tomorrow morning so that you can review the document. And we welcome additional feedback. Now, the last question that we would like to ask prior to moving into our call to action is, what should our immediate next steps be? And I think a few of you have spoken to some of these issues, the need to keep momentum going, the need to possibly get some earmarked funds for a strategist, a fund development type of individual, maybe looking at some recently retired individuals who can help carry the water and carry the message so that we can move forward. But what are some of those immediate next steps do you think we need to take in order to move this community action plan from a plan to an implemented strategy in our community? And you can note your ideas in the chat or raise your hand. Any suggestions? Deanna did include the link to the Inclusive Health Care Taskforce page on the DAAA website. So make sure that you grab that.
Deanna Solomon said, clearly identify community values.
Definitely, you definitely have to make sure that those values, those community values are sort of like the pillars that will support our work. And I think when we look at the whole issue of digital divide, but also the whole issue around health disparities, in light of being in a COVID-19 pandemic, I think that it will resonate well with the individuals that we need to approach to take this plan and this message. But we definitely have to make sure that it's bolstered on those community values. If there aren't any additional comments, we'll move into our community call to action. perhaps I see that someone added, Jamie Jr. added a comment about engaging Wayne State University Developing Disabled Institute. So that's something we can definitely do.
Yes, ma'am. They have, I'm sorry, this is Jamie speaking. They help train medical professionals about the intersections of disability and health. And they also engage grandparents that are helping to raise children with disabilities. So they would be an excellent partner.
Thank you so much for that. And during our conversations in some of our subcommittee meetings, there was a lot of discussion around grandparents raising grandchildren and intergenerational exchanges and making sure that that happens. And you're so right that we need to engage those partners and bring them to the table. And there's some other suggestions in terms of the Wayne State University Institute of Gerontology. I'm a graduate of that entity. So they definitely need to be at the table. Any other suggestions? Thank you so much for all the wonderful ideas being shared this morning. Okay, now we'll move to the call to action and our next steps. One of the things that we will be doing over the course of the next few months is finalizing our Inclusive Healthcare Community Action Plan. We'll be adding the toolkit that was a deliverable, as well as this plan to the Michigan Health Endowment Fund, who's supporting this effort. And then once we do that, and that's due May 2nd, we'll be looking at strategies to solicit funding from public and private sectors to continue implementation, realizing that there is a bridge of time between our planning grant and the implementation grant that will be available for us to seek through the endowment fund. We'll also engage AARP Michigan, MPHI, and other partners in this whole issue around human capital and how we can move to the next steps. And we'll also be reaching out to additional partners that we're not able to engage in this planning phase to make sure that they will do so during our implementation. And I thank all of you today for sharing some of those partners that we need to approach. In addition, we will be maintaining that Inclusive Healthcare webpage so that that will be a place, a central place where our committee members can go to get additional information on what we're doing, any meetings that we're having, and the like. And again, that's DetroitSeniorSolution.org, Inclusive Healthcare Taskforce. And then most importantly, we will be inviting all of you who participated in the planning phase thus far to be engaged in the future. So we'll be in contact with you to let you know when there are meetings that are planned so that we can further engage you. If you know of community stakeholders, corporations, businesses, and seniors or caregivers, grandparents raising their grandchildren who should be brought into this process, please share that information and we will make sure that we engage them. One of the things that I wanted to do is to make sure that we really recognize the powerful, powerful work that has been a contribution of MPHI in the like of Dr. Renee Kennedy, Philip Barnhart, and others on their team. They absolutely brought some terrific processes to our strategic planning, and they brought some great cutting edge technology, Miro boards and FIS5 and all kinds of neat strategies and tools that we will embrace in our implementation phase. So we really thank them for their leadership and their engagement, their enthusiasm and expertise. Couldn't do it without AARP Michigan. We want to disrupt aging too. And so we'll continue as a partner with you in doing that. Also like to thank all of you and DAAA's internal planning team for making all of this happen. It's been 6 months, 8 months of great planning, and I love planning and engagement. So stay tuned. And thank you so much for being a part of this summit today. And we will stay connected and get the job done. Thank you so much for being a part of this initiative.
And this is Paul Bridgewater. I just want to thank you, and I really have enjoyed this format and discussions. And again, you know, this is it's technology, is something new to me, so I'm certainly having fun. So thank you, Ann.
It was great, Mr. Bridgewater, to have you join us. And we stand on your shoulders. We stand on the shoulders of all the research that you brought to the table to look at premature death and the health disparities. And it was our goal to look at the dying before their time results and to look at how we could better integrate and coordinate the social determinants of health so we can really reduce those health disparities and that premature death. And that's been exacerbated by the COVID-19 pandemic. But I think with all of us standing hand to hand, foot to foot, that we'll get it done. Thank you so much for joining us.
Thank you, Ann.
Have a terrific day, everyone.
Thank you, Ann and Philip. Thank you very much, and everybody.
Enjoy the good weather.
Yes.
I will. Thank you.
Thank you.
Thanks, Deanna.